Now, next presenter is Dr. Pragya Bhattacharjee. She will talk on Beware the Deceptive Tumor, Unveiling the Wolf in Sheep's Clothing.
Good afternoon, judges and this August gathering. I am Dr. Pragya Bhattacharjee, a junior resident from RIO Hyderabad. And before I start this presentation, what if I told you that sometimes even a harmless looking mask can hide a more dangerous truth? And therefore, I titled my presentation with a caution that beware the deceptive tumor, unveiling the wolf in sheep's clothing. No disclosures. Now, there are two main characters of my presentation. First is the harmless looking sheep. I call it harmless because initially we thought it was a sebaceous cyst, but as the story unfolded, this sheep turned out to be the wolf, an unsuspecting but later histopathologically confirmed tumor which was disguising itself very innocuously. Now, our patient was a 73-year-old female who presented with a mass in the left nasojugal groove just below the medial canthus, progressively increasing in size over 2 years, with a size of 20 into 15 millimeters on presentation, dome-shaped with a hyperpigmented nodule at the top, cystic to firm in consistency, non-tender with an adherent overlying skin, but free from the underlying tissue. She also gives a history of incision and drainage 6 months ago. So on the basis of the clinical features and the history of an IND, we thought that maybe it's a sebaceous cyst. So nonetheless, it was completely excised and the mass was sent for a histopathological examination for confirmation, and she was advised for a regular follow-up. But when we received the reports, we were a little unconvinced with the diagnosis because it stated that it was a biphasic tumor, most likely to be an orbital pleomorphic adenoma. Now, me being a postgraduate trainee, I always thought that the mass is suspected to be an orbital PMA if it arises from the superlateral quadrant of the orbit. So either maybe it was a misdiagnosis or maybe it was an ectopic pleomorphic adenoma. To confirm the diagnosis, again we repeated a histopathological examination and also requested for an immunohistochemistry. And again this time it was not the sheep that we were expecting, but the wolf that I did not know existed. The histopath report stated that there were tubules and ducts lined by cuboidal and myoepithelial cells lying in a chondromyxoid stroma, and also along with it there was normal subcutaneous tissues. On other sections we could also see chondroid differentiation of the myxoid stroma. It was immunoreactive to pancytokeratin and to cytokeratin 7, which were highlighting the ductal epithelial cells, and also to P63 highlighting the myoepithelial cells. Now all of these findings were indicated towards a mixed kind of a tumor, but not exactly an pleomorphic adenoma. We had epithelial components which was well organized into ducts and tubules. We had decapitation secretion. The myxoid stroma was more cartilaginous than gelatinous, and there was also adjacent normal subcutaneous tissue, all of which indicated towards not a pleomorphic adenoma, but its cutaneous analog that we known as chondroid syringoma. Now, these are rare cutaneous mixed tumors with a reported incidence of 0.01 to 0.098% of all primary skin tumors, most commonly seen in the Middle Ages to the elderly males in the head and neck region. Our case is atypical and unique not only in its demographic presentation, but also in its presentation as a cystic to firm mass with overlying hyperpigmented skin. As far as literature goes, there are 28 reported cases, and ours would become the 29th case, and the first case presenting in the nasojugal region with hyperpigmentation of the overlying skin. Therefore, to conclude with its clinical implication, chondroid syringomas are rare tumors to present to us, and hence very likely to be overlooked and misdiagnosed. Preoperative investigations make it indistinguishable from its differentials like sebaceous cysts and other nixal tumors. Therefore, histopath examination becomes gold standard. Given its possibility to recur, become malignant, and metastasize, having prior knowledge would prove to be crucial. And with this, I conclude. These are my references. Thank you very much for your patient hearing.
Yeah.
Thank you, sir.
Nice, rare